Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
I'm joined by Tina Grosowsky, and we're here today to talk about cigarettes versus vaping. So my first question for you today is, a quarter of high school students have been using e-cigarettes because they think vaping is healthier than smoking. Is that true?
What we say is that it's less harmful than smoking regular combustible cigarettes. But nicotine is not harmless, and we know that using the vaping products, which have a lot of nicotine in them, is not harmless, especially for the developing brain, which adolescents, their brains are still developing.
Can you explain what vaping is?
A vaping device is really an electronic device that has a battery in it and a cartridge of nicotine, which is in a substance called propylene glycol, which is an oil, vegetable-like substance. And then it has the flavorings, which is chemical-based. Diacetylene is the chemical. So the nicotine is a drug that is addictive, and then the flavorings are drugs that can cause anomalies in the lungs, and we don't know the long-term effects of it.
What is the liquid inside that they are ingesting?
Propylene glycol is an oil-based substance. So another reason why you think that they're healthy is because they think it's water vapor. But it's not water vapor. It's this propylene glycol oil, which the little research that we do have on it does show that it's not harmless because it's going into the lungs. So the more information that we can provide for teens and for their parents about the vaping products is really important.
What is in the liquid that they are ingesting?
The appeal is the flavorings, and especially when they make them in these flavorings that are cherry, grape, bubblegum, cotton candy. We know that youth in this country are raised on flavored cereal, candy, Jell-O, yogurts, and even medicine. When young children, get ear infections from a really young age, they're given antibiotics, and those antibiotics are always flavored with bubblegum or cherry. So they've been raised to think that flavoring doesn't necessarily mean unhealthy, that we even put it in medicine, and that's good for you. So it's a confusing message that the industry uses by using these flavors to attract youth. And they do it by using these sweet flavors. They attract them by using cheap products, because most of these products are less expensive than a package of cigarettes, and by making them available and easy to get in convenience stores, gas stations, corner stores, pharmacies even in some towns.
Is there a nicotine jolt from vaping?
Yes, so nicotine can provide an instant sort of high for the developing brain especially, and kind of a buzz. And young people especially who are a little bit depressed already, who may be suffering from other psychological or neurological challenges, can benefit from that kind of buzz because it makes them feel a little bit better. So in essence, they're sort of self-medicating with the use of the nicotine, and that's why we want to get information out about it. We want to get school nurses trained in how to address the problem in schools, and for adults to understand that nicotine is so addictive, so that when kids are using them, it's because they're addicted to it and they're trying to figure out a way to get through the day by getting nicotine.
What can we do about this problem?
Our strategies are to implement what we call youth access regulations at the local level, and we do that through collaboration with the local boards of health in towns in Massachusetts. So many towns have put these local access regulations into place to limit the access to these tobacco and vaping products for youth. An example is called a pharmacy ban, where the local board of health votes to ban the sale of all pharmacies from selling tobacco products, and that includes the electronic cigarettes and the smokeless products and the vaping products. Another example is a flavor restriction, where you restrict the sale of these flavored products to an adult-only establishment. So if people are interested in finding out more information, they can go to the website getoutraged.org, or they can contact me at 508-856-5067 to find out how they can get more information or get involved in their local communities.